As soon as we identify postpartum hemorrhage, they don't have 2 lag bore leads in, they're gonna put them there, they're gonna start fluids, and then they're waiting for blood, they're gonna immediately call for blood. They can do uterine packing, okay? But here's the thing with uterine packing. Uterine packing just makes you feel better because the blood's not coming out. It will certainly put some pressure on those blood vessels, but it's a very transient solution. A very transient solution. Ultimately, you've got to figure out the problem and fix the problem. If medications don't work or medical management doesn't work, they can do a artery ligation or ultimately a hysterectomy. So that is not going to be your initial. Okay, uterine packing is not the first thing that you do. First thing you do is we're going to give these patients some medication. Usually we already have oxytocin going, so you can increase the dose of oxytocin. You can add methadone. Those are our first lines, and oftentimes they give them together. Again, oxytocin's already going, they'll increase it, then they can add methadone. If mom was induced for preeclampsia or hypertension, then you cannot use methadone. You would go to the next one, which is Hemabate. Okay, Hemabate can be used for hypertension, but cannot be used for asthma, you see, liver, seizure patients. Okay. Ultimately, if those don't work, they can go to misoprostol, okay, to try to increase uterine tone. But usually, they'll wait about no more than 30 minutes between different interventions. So what I have seen is initially the oxytocin is going, they're going to increase the oxytocin, and they're going to give it a few minutes. Yes? No. There's no contraindication, and it's not on here because ACOG doesn't specifically talk about it, but they're giving it. Yeah, they're definitely giving it. Remember TXA, we can give 1 gram or 2 grams of TXA. The way they're giving it still, they would do 1 gram, and then they're doing it, oftentimes they do 1 gram to 1 gram over the next 3 hours. But there's nothing wrong with slamming some TXA in there. Okay? But we give that oxytocin, increase the dose. If that's not working after several minutes, then they'll do the methadone, and they'll usually does the trick. All right. That's it. Please reach out if you have any questions, and I'll try to post a review in the next day or so for the exam.